Facebook for our show, Pulse by HealthJobHub. My name is Prashanti Naidu, founder of HealthJobHub.com. I started Pulse to connect, share, and inspire. My mission is to unveil the pulse behind the pulse. Before we start our show today, I would like to wish my mom and all the mothers a very happy Mother's Day. Today, I have a very special guest joining us live on Pulse. It is my honor and privilege to welcome Dr. Dr Sanpersad, joining us all the way from Durban, South Africa. Greetings and good wishes, Dr. Sanpersad. Thank you for joining us. How are you today?
Greetings to you also, Prashant. I am very well. I hope you're also very well.
I am. Thank you so much. How's the weather in Durban today?
It's a beautiful day. We're running at about 26 degrees Celsius, with no clouds in the sky, and an absolutely gorgeous day.
Oh, wow. Well, I envy you. We have snow on the ground early this morning. It's absolutely beautiful, the snow, but I can imagine having 26 degrees could be quite nice too.
Yep. I think it's, but with the lockdown, there's not much people can do, and I hope they are not doing anything.
I hope so too. That is actually a good point. To all our viewers, Pulse by HealthJobHub is a live talk show. So if you have any questions or comments, please post them on the live chat and we will answer them. If you enjoy our show, please smash the like button, subscribe to our YouTube channel, and please share with your network. I'd like to thank our sponsor, Kirshen Naidu & Company, Inc., attorneys at law. They have offices in Durban, Johannesburg, Dundee, and consult nationwide in South Africa. In response to COVID-19, Kirshen Naidu & Company are offering free legal advice and drafting of wills to all frontline healthcare workers and professionals who are fighting COVID-19 and saving lives. WhatsApp 083 777 4569 for more info. Dr. Dr Sanpersad is a high achiever ever since childhood, when he finished as the top pupil in primary school. He matriculated from Stanger M.L. Sultan High School, where he played soccer, was the head prefect, and received the Dux Award. He featured in the top 10 in South Africa in the matric exams in 1979. He graduated in 1985 from Natal Medical School and did his internship at various departmental rotations at RK Khan Hospital, including general medicine and pediatrics. He was a registrar in neurosurgery, including general surgery, trauma, and emergency medicine. He is in general practice since 1993 at Life Westville Hospital in Durban, South Africa, working independently but integrally with the management team. He started the fledgling emergency unit at the hospital, working as an independent contracting practice, and has grown it from a small practice to a practice now offering all facets of care. The hospital offers all specialities and subspecialties. He has gone on to attain several other qualifications, such as a diploma in forensic medicine, diploma in health services management, and certificate in travel medicine. He has worked in clinical forensic medicine, including working with inmates in the Westville prison in Durban. Despite all his outstanding academic and professional achievements, Dr. Sanpersad's passion is to serve his local communities and to do volunteer work. He participates in a socially run feeding scheme with local religious leaders, politicians, and philanthropists, sponsoring food for the needy. He supports many religious projects in South Africa. He is also the media and sponsorship chair for the Durban Central Football Association and owns a soccer team in the regional league in the eThekwini district, 4th tier and semi-professional. Dr. Sanpersad is currently the chairperson of the Westville IPA, the representative organization for the doctors and auxiliary service providers at Life Westville Hospital. He also serves on the medical advisory committee at the hospital and currently on the team for action against COVID-19. It must be noted that the COVID-19 action team is not a reaction team, but an action team because they have planned ahead and thus far relatively smooth sailing in management of PUIs and COVID-19 positive patients. Dr. Sanpersad is ably supported by his ever-understanding wife, Sandy, and their 2 sons, Ashvir and Yugesh, and daughter-in-law, Shikara. Never forgetting his hard-working parents taught him. Actually, never forgetting what the values his hard-working parents taught him. Wow, Dr. Sanpersad, this is an extremely impressive bio. Congratulations on achieving so many outstanding accolades.
Thank you, Prasanthi.
Please share your story about... Sorry, say that again?
A part of the job.
Please share your story about what inspired you to pursue a career in medicine and become a physician.
Prasanthi, we grew up in a very rural community, farming community, where parents worked on the farm, and obviously saw the need to move out of there because we had lots of poverty in the area, and despite all the efforts from everybody in the environment, it was still very, very difficult and tough to survive. Mm-hmm. But we did it. But it took lots of hard work and lots of courage, lots of encouragement from our teachers, lots of encouragement from the community members. Of course, the biggest push came from our parents who worked so hard to make sure that they sometimes didn't have, but made sure that we continued our education and pushed us to the limits where we actually thought maybe too far, but the results actually show that they did the best that they could. I'm very proud of where we come from, and it's a very, very poor community, and lots of the people from the area have actually progressed on to become, professionals in most regards, and lots of them are actually watching the show, and I want to say hi to everybody there. We're very proud of everybody that's achieved anything in the area. We also say to all of those that are still living in the area to aspire, and your inspiration comes from all the people that have actually achieved something in their life. I'm sure that there are lots of youngsters who are going to come out of our environment that are going to make us all very proud.
100%. That is truly inspiring. And, it's wonderful to hear your story coming from humble beginnings and making such an amazing impact on this world, especially in healthcare where it's so much needed. So congratulations. Thank you. Please share with us.
It would not have been possible without the efforts of some philanthropists in the area. Mm-hmm. And may I mention them?
Yes, please do.
I owe lots of gratitude to some people in the area, and just to mention some of them, and if I haven't mentioned them, it's actually an oversight on my part. But I would like to say thank you to everyone in that environment where we grew up that was on the farm, and especially to the Stewart family who owned the farm, Mr. Ajit Bodasing, who was an extremely generous philanthropist who assisted a great deal in my career and setting me off, to becoming a doctor and encouraging me all the way to do that. Because We had our teachers from the primary school, Harry Bodison Primary School, and my teachers in high school. We've also want to thank Mr. Madan Singh, who was a driving force and, really in many ways. And he actually took me to my first interview at the medical school because I did not have transportation to get there, and made sure that I got there, and I got there late. And he made sure that he spoke to the dean and said, "You cannot not hear this young man." So the dean felt so sorry and decided, okay, I'm going to hear what this young man has got to say. So yes, and I got into med school also because of that.
Oh, wow. That is unbelievable. And I'm sure something had to have done, also helped being top 10 in South Africa when you matriculated. That definitely could have helped your application to med school.
Yes, there was no problem with the application to med school. It was the fact that we couldn't get there in time for the interview. But lots of things helped, and of course, all the obstacles were overcome because of assistance from everybody else, and especially the people that I mentioned.
Right. Wow. No, that's absolutely fascinating. And I love the way that you remember everybody who's helped you in your journey. And thank you so much for sharing about them on the show today. I appreciate that. We have an active chat group, and I see that there are questions coming in. So, Dr. Sanpersad, as we are moving through our questions, I'm going to take viewer questions at the same time, just so that we are able to also include our viewers in this forum. So I see a question from Lalitha Naidu. She says, earlier today, the premier of KZN reported that 9 mothers, several babies, and 7 doctors tested positive for COVID-19 at Stanger Hospital this week. Can you tell us how doctors become infected? Are they not protecting themselves using the proper PPE? How are your doctors being fully proofed against COVID-19 in your hospital?
Just a disclaimer, I'm not a spokesperson for the Department of Health, and Department of Health would be able to answer that question better than I can, because I do not work in the public sector except in forensic medicine. So the clinical aspects I'm not able to answer for you. Mm-hmm. I can let you know about our practice in the hospital, which is a private sector hospital, where we do provide adequate PPE. Adequate planning has gone into what sort of PPE and at what level. We've got different levels that one would be protected at, like at admission, during stay in hospital, in ICU. So they all are coded according to the level of seriousness, and the level of seriousness dictates how and what type of PPE is used. That is also governed by and guided by the WHO's recommendations on these levels. So at our hospital, I can say that we've not had any doctors who have converted to being positive. We've got adequate PPE. There are lots of factors that possibly play a part in doctors and nurses becoming positive. Mm-hmm. One of them would be PPE. The other factor would be, did you use your PPE properly? Did you utilize it all the time? Were you given the opportunity to change your PPE between patients or at breaks? Where did you go to in your contacts after you left work, your community contacts? So all of those factors play a part. But as I said, I'm not a spokesperson for the Department of Health, and I would hate to be quoted as saying that was a cause for what had happened now.
No, absolutely. And I thank you so much for taking our viewers' question. And thank you, Lalitha Naidu, for asking the question. Moving on to our questions for the show. Please share with us the work you do in your current practice and some of the innovative new procedures and therapies you offer at your clinic.
I am in private general practice, but I also head up the unit in the Life Westville Hospital, who, again, I work as an independent contractor for them. I am not a spokesperson for any policies that Life Healthcare has got, but we do apply the policies that are filtered down from their management to us. So we do work very integrally with the management in formulating policy, but policy ultimately is generated by corporate. So just to let you know what exactly we do, I have a private practice at the Life Westville Hospital,
Yeah.
providing family care and emergency care
Yeah.
in my rooms, my consulting offices, and I employ a team of doctors that support the hospital in the emergency unit. The emergency unit carries the brunt of COVID exposure. Of
Mhm.
course, my practice in the rooms has got all the necessary PPE according to international guidelines. Medicine is not a secretive field. It is a field where we firstly do no harm to any of our patients
Mhm.
and make sure that we as medical practitioners are protected
Mhm.
and offer the same kind of protection to our patients and our co-workers. So in the hospital, of course, we offer a service that is geared from any kind of possibility of any emergency that can come into our unit, ranging from common respiratory issues through to trauma,
Mhm.
myocardial infarctions, any coronary syndromes can walk into your unit. So we got to be prepared for every aspect.
Yes.
The types of services that we offer are based on world standards and
Mhm.
acceptable standards. They may, in some instances, be adapted for our local consumption. And it depends on resources also. But
Yes.
we're a very well resourced hospital.
Yes.
We, in the hospital, provide emergency care to all categories of staff. In the unit, we've made sure that PPE is up to standard, and as I said earlier, according to the WHO standards, and perhaps even more. The hospital management has been very, magnanimous and generous in providing us with the PPE requested because we have
Mhm.
requested it in time. So
Yes.
to that extent, I want to thank Mr. Atish Maraj, the hospital manager, and for having been great, listening to our concerns and actually acting on the concerns and providing us with what we needed. So you can see my nurse standing there in all her PPE for an entrance level kind of person, but you can see she looks like she's standing in space.
Yes.
Yeah, she's showing you. You may be wondering what the different gloves are for, but those are different layers of gloves. So she's got the one showing that she's got an underglove, and on the other side she's showing that she's got another glove over that, which is actually the longer glove, the so-called long sleeve glove, which then protects for at a higher level, and of course all the necessary PPE. Yeah, then we've got for safety for our doctors and for our nursing staff so that we don't get aerosols spread. And especially if we are needing to intubate and ventilate a patient, we've got all the necessary equipment, and including the full coverall suits, we've got the full masks, and when intubating the patient, we've got the so-called head box, which allows us to intubate the patient and get a reasonable amount of protection
Mhm.
from, and it's an internationally accepted standard that we will be able to use this and protect all those around us also, and including the doctor that's intubating that patient for ventilation.
Wow, goodness me, there's so much that has to go in to, just protecting yourself as healthcare providers and also protecting the patient. How long does it take you to change in and out of these PPE? And do you have to do that for each patient?
We do that for each patient because of potential for spread. But there are different layers of PPE that you would wear. So if in our instance, we could change out a PPE and change out completely. But in some instances where PPE is scarce, one would extract the external layers of PPE, continue doing your normal work, and then don the external PPE thereafter if you had to deal with another patient. So we've not had any transmission from patient to patient or doctor to patient in the hospital, and all the information and all the infections have actually been either community acquired or from person to person contact in other situations.
Yes.
It
And
doesn't
this
take long
also,
to. It doesn't take long. Sorry, I didn't. It
no, no.
doesn't take long to actually don and doff.
Oh, good. Mm-hmm. No, thank you for sharing that. And this photo you were telling me about is the cleaning that goes on after a patient is seen in a room.
Yes, this is. We have individual cubicles for each patient. We've got a number of cubicles that the hospital has provided in the premises, and after each potentially infected patient, a person under investigation, the room would get swabbed down and fobbed with that little machine that our sister is showing us there.
Wow. Yes,
And
there's a lot.
that takes an hour. That takes an hour thereafter before the room could be utilized. So there's a lot of rotation of the rooms. So some rooms will not be available when that is being done.
Wow, that is really an extensive process. And thank you for sharing that. I think that will give a lot of comfort to patients, especially listening to this program, to know the measures and precautions you take to keep yourself safe as well as the patient safe. So that was really interesting and informative. Thank you. Dr. Sanpersad, we have another question, and I'm going to show that in the stream. It's from Devin Naidu, and he says, Doc, my dear friend, please let the viewers know how you manage to serve this profession on 7 days a week. I know that you hardly take a day off, and that is indeed rare. We, the class of 1979 of Stanger ML Sultan, are absolutely proud of you and what you do.
Thank you, Devin, my old friend. He's not old, he's very young. Young at heart. Devin, it obviously takes a bit of effort on my side. As one gets older, the effort is a lot harder. But every day, the fact that I can get to work and assist somebody gives me that drive to get out of bed and get to work. The fact that I can also interact with other people and make their lives better gives me that drive to get there. So I hope that answers your question, Devin. And you're one of the guys that drives me to work every day because you get up very early.
Oh, that's wonderful. I'm so glad
May I
to
take this opportunity of saying hi to all my 1979 high school buddies. I'm proud of you guys also.
Oh, absolutely. I can actually hear them shouting out to you that they are so proud of you too. So they all are sending hellos to you as well. It's absolutely fascinating so far. Thank you for sharing so much of great info.
Can I share with you some of the about the processes that we have at the hospital that will allay a lot of anxiety for patients that potentially may use the hospital? Mm-hmm. The hospital has made the effort to separate the passage of patients into the hospital, where patients at the hospital entrance get screened for their temperatures, for their past history, travel history, and any contacts by the nursing staff. Mm-hmm. And from there, they get triaged into either the normal emergency facility or what we would colloquially call the COVID clinic. So when they get to the COVID clinic, and if they decide, and we decide that they need to be admitted, then we have a separate part of the hospital designated for that, and we class them according to the seriousness again, whether you are a green code, whether you are orange code or yellow code, and red code. So the red code obviously will be the ones requiring ICU. So the ICU for the COVID potential patients is separate from the general ICU that we'd utilize. So you're completely safe in an environment that has been designated for the purpose. Those that are significantly ill but don't require ICU will then also be pushed into a separate ward if they require admission. Mm-hmm. And they would await the swab results from the laboratory, and we have got a great understanding between the Lancet Laboratory and AMPAT. Mainly Lancet Laboratory does all our work at the Westville Hospital. Mm-hmm. And within 12 to 24 hours, we are getting results which then be able to triage those patients into the different areas. Once they've got a negative result, then they step down to the green area. So once they've got the green area, then they sort of are relatively free. If a patient is also in a patient under investigation that perhaps maybe in an asymptomatic phase or pre-symptomatic phase, they would be triaged into the yellow area or the green area and awaiting results. So again, once they got cleared, then they would be passed on to the general hospital. We've got a separate theatre if the patients will require theatre work and we're not sure about their status, they would be operated on in a separate theatre that are designated for that purpose only. And again, the same kind of precautions would be undertaken for them to be able to separate and keep infection control at its best. So again, the hospital is actually, Life Healthcare has actually helped a lot in listening to what the doctors have had to say, what the healthcare workers have had to say, and we've actually done reasonably well with that without needing to spread infection to anybody else.
Absolutely awesome. No, that's great. I feel so much more confident as a patient to go into a hospital setting now that you've described so well on the measures you take to keep everybody safe. And I think that's one of the biggest fears with people, that, you know, you get scared to go into a clinic or to a hospital because you don't want to contract any viruses by going there. So thank you for sharing the extensive processes that you have placed to keep people safe.
Okay. I'd also like to say, look, it doesn't take one person to run the system. It is a cooperation from management. It's colleagues who actually partake in all of these activities. And at the hospital, we've got designated teams. I mean, I run the emergency unit. Then we've got teams that run the wards, and we've got people who run the...
Sorry, Dr. Sanpersad. My son has woken up at this hour. I'm just going to give me 1 second. There you go. Thank you. I'm so sorry about that. Usually, because it's 8 o'clock in the morning, they are fast asleep. But today, he's decided that he had to come down and be a part of the show.
No problem. It's a team effort, and we have designated teams from different disciplines. And in the hospital, we've got a COVID committee that consists of the nursing staff, nursing management, the hospital manager, the infection control, the pharmacy, all disciplines, including anesthesiologists, the physicians, the surgeons, the cardiothoracic surgeons, neurosurgeons, emergency medicine, that all come together to be able to keep this team together. And the people that have been driving the facilities COVID program at Life Westville Hospital have been myself, with Dr. Pranita Bajnath, with Dr. Jatin Keshav, Dr. Shiven Ramdial, Dr. Kriyesh Modi, Dr. Sureka Maraj, and of course, our infection control specialist, Dr. Sister Patricia Javon, nursing manager, Melody Janssen van Rensburg, and Diana Shandagut. So hats off to you guys for all coming on board and making this happen and keeping our facility safe.
That is wonderful. It's such an extensive multidisciplinary disciplinary team that you've just acknowledged and mentioned. And I'd like to take this opportunity as well to thank you and every other frontline worker for going to work every day and to help keeping us all safe and saving lives. Thank you so much.
Okay. Well, it's part of our job to do that, and we are very proud to be able to do that properly and for the safety of our patients, colleagues, and everybody else that utilizes the hospital, even visitors.
Thank you. I have another question, and this is from Arnold Chetty. He would like to know, is it easy to access N95 masks at the hospital, or does one use the KN95 mask or even level 1 to 3 face mask?
For different levels of work, we would utilize different levels of masks. So for general use in the wards and if one's not doing any aerosol generating procedures or not examining a patient that's potentially a high risk, these surgical masks would suffice.
Mm-hmm.
If we're doing any aerosol generating procedures like intubating a patient or examining a patient, taking a swab from a patient, looking down the throat where there's always a high risk of potential for infection, then we would use an N95 mask. If I'm even worried about that, I would don the other fancy mask that I showed you that has got multiple filters and covers me entirely, and my face entirely.
Wow, like I can't believe that you have to put all this gear on. It just goes to show how dangerous this virus can be and how much precaution you need to take. So thank you for sharing that. I have another question very quickly. It's from Karshni Naidu, and she would like to know, can they deal with the numbers that are going to come through?
We have a network of hospitals in the Life Healthcare Group that have all come on board. So should the facility get overwhelmed, obviously we've got limitations to the number of beds that we have according to the DOH rules. We would be able to transfer those patients to another facility, providing that we've stabilized them. So yes, we have a big network, or any of the other group hospitals, because there's multiple groups in the province and in the metro of Durban. We would be able to transfer them after discussion with the necessary department and transfer them to the necessary facility. But we try and keep our beds for the emergency patients, the high-risk patients. We at the hospital are not at the moment doing any non-emergency surgery. So that frees up a lot of beds, and it actually assists in infection control a lot.
Wonderful. And that's the same situation here in Calgary as well. I think across the world as well, that I've interviewed a few different physicians from Australia right to Boston, Massachusetts. They all are experiencing the same, not doing any non-essential work at the hospital right now. We have,
as you know, our dictum is, as I said earlier, there are no secrets in medicine. We share information, we utilize information to the best of our ability, and we use each other and our experiences to afford the patient the best care and safe care.
Wonderful. You are the first guest that I've got so much of comments and questions coming in from the viewers. I think this topic is really at the core of people's thoughts right now. So I do apologize by interrupting you so much, but do you mind taking more questions? I have a couple more questions coming in from the viewers.
I can try.
Okay, we have a question from Dr. Swaran Singh. He asks, N95 is in short supply. Use is restricted to specialized procedures only. KN95 has just arrived from China. So I'm not sure if that is actually a question or a statement. I don't know if you have a comment on that.
I think Dr. Singh is actually making a statement, which is the truth, that the N95 masks are in short supply. So we are restricting them for the procedures that we would need them for. As I said, aerosolized procedures like intubating the patient. If we are going to be doing anything that's going to be generating any potential for infection with aerosol, we would utilize them. Examining a patient who is high risk, yes, we can. The KN95 has got its use. It has got restrictions, but when you don't have any PPE is good enough. It's going to have to serve its purpose. And of course, taking due precautions with that is going to be important. So you would not, if you don't have adequate PPE, you would not start sticking, your neck into somebody's throat, as I said. Not literally.
Absolutely. One more question. It's from Arnold Chetty again. Do you think the lockdown should be extended? And when do you think it will peak in Durban or even South Africa?
I'm not an epidemiology expert, but I'll give you my personal opinion on it.
Yeah.
I think that the levels of lockdown the current level of lockdown should be extended for a little longer. It's going to have serious repercussions on the economy, but I think the outcome would be a better outcome. We can already see with the easing of the lockdown, numbers are starting to increase.
Mhm.
And I think the law enforcement needs to be stricter with people that, especially with wearing of masks, the safe distancing from person to person must be enforced. The number of people in a vehicle should be enforced. The, my personal feeling is that the lockdown from 8 o'clock in the evening to 5 o'clock in the morning must be strictly enforced. All entertainment places should actually be shut down for now. And as much as I'm going to be shut down for that, because it really is going to impact seriously on those establishments. But I think the bigger picture must be seen. If we don't have people to come to your establishment, then your business is worth nothing. So there are lots of people going to die if you don't actually look out for them. People are going to be seriously ill. So nobody will come to your establishment in the next few months if you actually don't look out for them now.
Absolutely, and that is such a harsh reality, but it is a reality. If we look at what's happened in Italy, which really opened the eyes of the world to how severe this virus can be and how many lives it can claim, we really need to take the precautions, and we really need to adhere to the stay-at-home orders. Only go out if it's absolutely essential. Because I would really hate to see South Africa, increasing in terms of their death rates and the virus just getting out of control.
I think we've actually done pretty well, because I think the timing from the president was more than reasonable, having taken into account the economic repercussions for it. He's actually done well in the timing, even the extension of the lockdown, taking into account all of those factors. I think we've been relatively better off than most other countries in the world, including the superpowers. Now, Mr. Shetty's also asked about when do I think the peak's going to come. We are coming into winter. We are coming into flu season. To distinguish the fact that the differences between the flu and the current and COVID-19 is going to be an extremely difficult task. So you're going to find that there may be a peak. The current predictions are predicting a peak about August, September. I hope the predictions are not true, and that we as a nation can actually, in South Africa, can actually control that by by actually adhering to all the necessary rules that have been placed so that we can control the infection.
Absolutely. Absolutely. I hope so too. Thank you. Thank you so much for taking all those viewer questions. And viewers, if you have any other questions that you really would like to address, please feel free to put it onto our chat. If we don't get to it on the show, we will definitely try and answer it after the show as well. Please, could you share with us the community work that you do? I know you've told me that the community work and the volunteer work is really at the heart of everything you do. I would love for you to share with us a little bit more about the great initiatives that you are pioneering and that you are a part of.
Life would not be complete if you do not assist your fellow human beings in every respect, whether it's healthcare or their general day-to-day needs and their social needs. Mm-hmm. So we cannot turn a blind eye to people in poverty and in hunger. Yeah. So we have initiated by the Dr. Sanpersad Family Trust a number of projects, feeding schemes in areas that are poor. We funded them ourselves. So any assistance in that regard can also be appreciated. Mm-hmm. So the projects that we fund are in some of the areas where we lived in, some of the poor areas and the informal settlements where we some days get requests from the residents themselves saying we do not have any food. And my family actually cooks the food and distributes for them, even if I'm not there. So they don't necessarily wait for me to be there to be able to do it. So they've got enough background to be able to do that on their own. And every part of the extended family comes through to assist. We've also got the project that's quite dear to our hearts, and we've initiated the awareness of religion and culture in our society. Sorry, I may have used the wrong word, not initiated, but promulgated the culture and religion, because I'm not an initiator of religion, because religion was here far longer than I was. But to reinforce that, we have actually gone through some of the projects and renovated some of the places and even built some of the places of worship with funding from our families. And we've done some work in Dalton, in Pietermaritzburg, and we are desperately trying to get a project going in the area where I grew up, that is New Gelderland, where, as you can see in the picture, it's a temple that's now almost it's going to be 100 years old this year, and we want to have and we want to renovate this to the standard that it actually, the pristine kind of condition that it was when I remember we used to worship there. We've all moved out of the area, but it's come under land redistribution from government, and the new owner has actually indicated that all cultural places should stay as they are. All the people that live there should have a right to be there. So it's his land. He could do anything with it, but he's opted to be to be magnanimous in that regard, and that's his Chief Dube from the Stanger district. So we take our hat off to him. But we are looking forward to any assistance that we can have towards renovating these temples to the standard that any place of worship would actually require. So you, via yourself, that you can, anybody that wishes to assist can get in touch with us, because it is not necessarily a project for the Dr. Sanpersad Family Trust, but it is a project initiated by the local temple community, and they would also appreciate any assistance. I can facilitate the contacts for them. Then the other project that we have is the local church is also looking at, and probably about the same duration. I think it's a younger church that needs some assistance. So if you are inclined that way, the Jericho Temple, which you can see in the picture, is also in need of assistance, and you also, by yourself, you can put people in touch with the necessary people, and you can deal directly with the trustees of these associations to assist in whatever regard you can. Then we've got the other project that is very, very dear to my heart, and before we go to that, the feeding schemes also include a little community in Newlands West and Newlands East in Durban, where the local pastor has actually approached us, and he's a very good friend of mine, and regularly walks into places and finds that the households are headed by AIDS orphans, and 15, 16-year-olds, even younger people are heading up households that, I mean, they're children. They cannot even, they're not even adults, but they're having to head up households. So we try and assist them in whatever way we can, and he assists them with the spiritual aspects, and distributes the food on our behalf to them.
Oh, wow.
He's done a magnificent job in fixing and helping to fix some issues in the community. Obviously, he's not going to solve everything, but a full stomach will probably not perpetrate the violence and crime that everybody thinks is possible. Sometimes the crime is done out of need, sometimes it's done out of greed. But some of the communities are seriously in need and would appreciate any assistance that can possibly come through. That little temple that we built in, of course, Ganesha is very very close to our hearts. He's a remover of all obstacles.
Mhm.
We're hoping that he will remove all obstacles in facilitating people to go back towards worship of your superior being, and assisting in whichever way we can in restructuring and resurrecting our culture. So
Yeah.
that was designed by my wife Sandy for the temple in Pietermaritzburg, in Dalton, near Pietermaritzburg, and you can see the beauty of Ganesha, and you can see all his glory waiting to be worshipped.
Yeah.
So we'd like everybody to do the same, and go back to Godhead.
Wonderful advice. That is absolutely stunning. The photo is gorgeous. It really is so inspiring to look at from a spiritual perspective. Thank you so much for touching on spirituality as well, because without a spiritual well-being, you're not complete. So thank you so much for sharing that as part of your talk this morning. I really appreciate that. I've got another photo from the temple. Is that also something that is that a painting that you've initiated?
No, that's my wife praying.
Oh, yes, praying. Okay,
Praying at the
yes.
temple. That is those are tiles that were painted on by. It was specially commissioned by her for the mural in the interior of the temple. So her choice, and I think it's absolutely gorgeous, and portrays the serenity in the place very well.
Very beautiful. Thank you for sharing those beautiful photos. I know you've also told me that what's really dear and close to your heart is the football or soccer team, rather, that you founded, the Sandoz Football Club. Can you please share with us more about this initiative?
Okay, it was in about the year 2000 that we founded the club based on a social need in our area, where youngsters were found to be hanging around the robots, and all over the place where they shouldn't be, and you know what the consequences of those possibly were. So we rounded up a whole lot of them, and started the football team from junior structures through to the senior structures. And we've done well. Just some constraints with regard to facilities, and playing facilities where was the biggest constraint. But we've kept a lot of them together. Lots of them have gone on to become professionals and have done so well in their lives. They probably would not have actually gone in that direction at all, and may have ended up in the very facility where we were practicing. That's the Westville prison. So, and the staff grounds were utilized initially, and now we've moved out of there because of our constraints. Lots of them have gone on to become professionals in the government sector, in the teaching sector, in accounting, and still keep in touch with me. We have a reunion every year for all the old players and the current players, and we try and have a function every year so that it's a big function where everybody comes together and reminisces of what we've achieved, and what can potentially be achieved in the future. Some of them have gone on to become professional soccer players in the South African sectors.
Wow.
This little photograph on this side is a picture of my sons when they won the indoor trophy along with the co-players, and the one with the red shirt is my son Ashveer, goalkeeper, and Yogesh in the front, who's the defender come striker. So indoor soccer is a little bit different from outdoor soccer. So we've got our hands in indoor soccer and outdoor soccer.
That's fantastic. And I love the way you share about the impact it's making on communities and keeping the kids active and safe and engaged more so in the right way. And then they are going on and they are pursuing careers that they may not necessarily have done because of the social engagement. So I really love the way that you are so holistic in your approach to life, that medicine is a huge part of it, but you also bringing in the social aspects of life to make a complete impact on a child and on a person. So congratulations, awesome work.
Thank you. We sure you're going to continue doing that in the best interest of our patients, and we're going to really work hard in the next few months. I know that.
Yes, I think so. But also, thank you for acknowledging them as well. A last picture that I just have in the center of the screen there with regards to all your initiatives. I know you shared with me a story that a Springbok player came and visited you on his kind of country tour in South Africa after they won the World Cup. Do you mind elaborating a little bit more on that?
Yes, the gentleman in the picture is a very good friend, and he's actually married to my very good friend that I know from the time she was like about 2 years old. He's Vincent Koch, and he's married to Yandri Stander, now Koch, and Yandri's family and I could go back a long way. And when Vincent married her, he became a part of our family also. So when he was selected for the Springbok team, we were extremely elated, knowing that he's very capable of producing the results which he duly did during the World Cup that we so nicely and won last year. When they did the victory tour in South Africa, he did not forget that I still existed in Westville Hospital. He did a stopover along with Yandri to come and say hello, to show off his medal, which is a gold medal that he's wearing now, and to acknowledge that we all were part of his success story. So he's very young, and I'm sure he's going to go on for a lot longer. He's an absolute gentleman. Rugby players usually are considered to be rough and tumble, but this is a gentleman.
Fantastic. Thank you for sharing that. This show has really taken on legs, and thank you so much for sharing with us so much great advice and stories. This brings us to the time when we talk about current issues, which I know we've covered so much in depth already. But do you mind just to touch on the response that Life Westville Hospital in Durban KZN, and how has COVID-19 impacted your community, the hospital, practice, and how have you been feeling, and what's your experience working during this pandemic? I know we touched on it a lot with the viewers' questions, but I would really like for you to share some last thoughts on these issues as well.
The hospital services are quite a lot of, and again, may I please make a disclaimer that I'm not speaking on behalf of Life Westville Hospital. I speak, and every one of these comments are my own experiences and feelings.
Mm-hmm.
I speak from the heart, and I would just like to let you know that obviously Life Westville Hospital management may very well be listening to this, so I do not represent them at all, except that we work together. The Life Westville Hospital services quite a big area that extends for lots of the metro area in Durban, because we are a service provider for lots of the funders. Mm-hmm. It varies from affluent areas through to the very poor areas. Mm-hmm. So it has impacted on the way we run our service. Life's not business as usual. Healthcare is not business as usual. We've exercised extreme caution in all that we do, sometimes even bordering on going overboard with our processes. But I would rather have that than having a disaster on our hands. We've thus far been able to avert most problems. We've been able to advise our patients adequately on how things should be done, how they should be consulting with their doctor, and how when they should be seeking medical attention. Seek the video consultations, seek the virtual consultations when necessary, or call your doctor if you don't know how to use those devices. So it has worked a lot. It has worked to advantage, but we anticipate that people are going to miss their doctor, the personal interaction, and start pitching up at the doors. That is the reality, because they would like to have that personal interaction, that the doctor actually sees what he's diagnosing. Yes, in some instances, it's great, because the virtual consultations sometimes do not convey what you'll be able to pick up in a face-to-face interaction. So what we as medical practitioners have got to do, is also exercise caution and provide ourselves with adequate PPE, educate our patients that, do not arrive, make appointments, because some of the people in the country are not used to making appointments and would arrive because they need attention.
Yeah.
So that mindset has got to change, and we should be moving towards a total appointment basis, so that we don't have a huge deluge of patients coming into consulting rooms, and we may not have the capacity to seat everybody. Please do not also bring in people that do not need to be with you, except if you are, frail, very ill, and you need somebody to come with you. So going on a little outing with children is not on, unless they are sick. Yes, it has changed the way we practice medicine. It has changed the way the hospital practices medicine. In the past, you had departmental, the different disciplines had different wards. But now every ward has got to be utilized via the triage system. As I said, your green code, your orange and yellow, and the red codes. You've got to utilize those and then triage your patients from there. So the system has changed in the hospitals. Look, hopefully by the time this pandemic is over, which we don't anticipate being over pretty soon, we may get some semblance of, going back to normality. But I think the general feeling is that we're never going to get back to the normal kind of operations in hospital, and patients need to get used to the fact that operations in hospitals are going to be different.
Yeah.
Once it's understood that operations are going to be different and patients cooperate, like one of the ways that we have actually tried to contain infection and to identify infections or potential people who infect other people is for the pre-symptomatic and asymptomatic patients, is to screen everybody that comes into the hospital and needs admission to the hospital with the COVID swab. It has met with some, resistance from the patients, but once we sit and explain to the patient what the necessity is, they do understand and will actually, comply. What we've also done, and as you also said in Calgary, you're also doing the same thing, is a non-emergency surgery should be performed, because you're increasing your risks in that kind of situations.
Yeah.
So yes, you may not get non-emergency surgery for the next few months, and there shouldn't be any pressure from anybody towards their doctors, because the doctors are not actually doing it deliberately. But because we've had to reduce the number of beds in hospital, there are no more shared wards that you can possibly utilize unless you've been cleared. So that where somebody could utilize a 2-bedded ward or a 4-bedded ward, you've now got a single bed. So that cuts down your number of beds that are available. And that's to protect patients. It's very difficult then to have those kind of numbers in a hospital without, increasing your numbers and decreasing your beds. certainly now, the Life Westville Hospital has been working to full capacity because of the process we have in place and the patients' understanding and confidence in the way we do things here. So we hope it will continue, and the hospital has to function, obviously. So I'm sure it will continue functioning. Just that emergency surgery, non-emergency surgery will definitely be curtailed. Now the tendency to is saying what is non-urgent, what is semi-urgent, and what is urgent. So some things are semi-urgent. So those kind of surgeries may be done, but non-urgent surgery, not at the moment.
Thank you for explaining that. And I think viewers are also cautious about, what are they going to be doing now in this period of stay home? Please, can you share with us your medical advice as well for all of us who are staying home and trying our best to stay safe, as well as now starting to prepare to return to some levels of normalcy? What should we be mindful of? And when we do resume daily jobs and daily tasks or going out a little bit more freely, what is your medical advice for us?
Universal precautions. Universal precaution entail common sense. Wash your hands when you meet regularly as possible. If you visit somewhere and you're not sure, either use a sanitizer and or wash your hands. Most people are not going to be carrying sanitizers around, so get to the nearest tap, wash your hands thoroughly, make sure that you are adequately covered. So the best way to do that is to wear a mask, and a decent mask. So you don't have to wear an N95 mask if you're not a healthcare professional, not working in an enterprise environment. Use, even if a surgical mask, even the so-called cloth masks that are being manufactured and which you can manufacture yourself if you can't access it. There are lots of material that you can possibly use even from your own wardrobe. So you utilize that. Safe distancing, interpersonal distancing. Stay away from people that you don't know. Stay away from people that you don't need to know. Stay away from places that you don't need to go to. Stay away from malls if you don't really need to go, because I mean it's a bit scary that when the lockdown even in South Africa was called off and brought down to level 4, the malls just got jam-packed, and it's either because people were short of food or essentials, or they just wanted to get out. But that's not the place to socialize, because that is a sure place to pick up something that you really don't want to pick up, and among them will be COVID and other transmissible diseases. So stay away from those kind of places. Exercise caution in as much as you can. If your work can actually provide you with access from your home and be monitored from home, that's the safest way to go. Manufacturing, unfortunately, is probably difficult to do that, but again, the employers need to come to the party. Employers need to make sure that they've got proper facilities for the staff to be able to practice proper hygiene, proper PPE when they are working, and of course the interpersonal distancing must be there. That's the best advice. And of course, respect the laws of the country. All of these recommendations come after due consultation, especially in South Africa, with due consultation with every department. The President has been extremely good in that, and he's consulted, and sometimes to the extent that he keeps the audience waiting for 2 hours, but not deliberately. And he's always apologized and said, I would like to get things straight rather than actually and clear, factual, before I would be able to come on and say, I want people to do this, or this is the law.
Absolutely. And I'm leaving our viewers with this last photo to just capture in their minds. This is how your staff and you yourself have to dress up accordingly. So I just want people to realize the amount of precautions they need to be taking personally as well from everything you've just shared with us. This is an example of what people should be striving towards. By no means they have to be doing, but they just really need to take in this level of severity of the situation and understand that social distancing is there for a reason. And thank you so much for enlightening us this morning and sharing with us all this amazing information. I've truly been inspired, and I've truly feel a little bit more confident as well now by attending a hospital if I need to, knowing all the precautions you have in place for patients to come there if an emergency.
Thank you so much for having me on the show, Prasanthi. It's I hope I've enlightened you in some way. If you have any questions, you're welcome to contact me. Lots of my friends I can see are on the just watching the show, so you know you can always get a hold of me. And I would really be amiss if I didn't wish all mothers across the world a very, very happy Mother's Day. You did at the beginning, and I'm going to say at the end of the show that you make the world, and without moms in the world is not a good place to be.
I can't agree with you more. I concur. Thank you, Dr. Sanpersad. This brings us to a close of our Facebook Live show for Pulse by HealthJobHub. I do hope that you enjoyed the show as much as I did. Please join me next week, same time on Facebook Live. I am excited to announce that our special guest joining us next week is Dr. Rashalia Naidu, a general dentist from Cambridge in the United Kingdom, who will be sharing with our viewers dental health tips to cope during COVID-19 pandemic. Please join us next week again to be inspired. And don't forget, if you enjoyed our show, please smash the like button, subscribe to our YouTube channel, and please share with your network. Thank you and happy Mother's Day, everybody.